a cystic area, they call it subcapsular. And this type of cyst may be one or two. That is due to the result of vasectomy. Okay? Due to the result of vasectomy. Okay, so you understood the internal situation, so it's going to help you. So now, these are, the testis has the parenchyma. The testis parenchyma can have infection, can have tumor, can have cyst, which is very rare. Okay? So now, what are the diseases a testis can have? I'm going to show you now. Okay, the varicocele I will discuss separately, but it is extratesticular. Am I right? It is not within the testis, it is outside. All the veins are extratesticular. Just note it. Okay, intratesticular pathology, number one, you will see cyst. Okay, so cyst could be testicular and cyst could be epididymal. Epididymal cyst, and epididymal in the head of the epididymis, you will see the simple cyst, another is spermatocele. Sonographically, we cannot differentiate, but with high resolution, we can see in spermatocele something is moving, because this cyst is formed by the spermatic fluid, and that spermatic fluid has a sperm. You can see it's moving. In that way you can differentiate. Otherwise, if you want to differentiate what is it, they will aspirate the fluid and under microscope they will see the sperm. And all those cysts look like a simple cyst, and they maintain the all four criteria of the simple cyst. Usually these are small and no sign symptoms. If this cyst is bigger, then it creates the pressure effect and that causes the pain. Otherwise, it is asymptomatic. And the treatment, usually they don't do the surgery, but they can decompress. They decompress the fluid and the pain is relieved. Now, after the cyst, we need to know that testis can have infection. Okay? Testis can have infection, and this infection we will discuss in this way. So, orchitis, when the testis is inflamed, and epididymitis, That means when the epididymis is infected. And when both of them are infected together, we call it epididymo orchitis. Okay, so now we will discuss about the orchitis and epididymitis. Okay, so now when there is a orchitis, what is the most common causes of orchitis? Bacterial. Okay, so we need to know the causes. Causes could be bacterial, viral, fungal. Bacterial causes, viral causes, mumps virus can damage the testis. And bacteria, lot of bacteria, that can attack the testis, and sexually transmitted diseases. And the fungi, those who are taking steroids and those who are having HIV, immunosuppressive disease, they will be a candidate for fungal infection. Okay, and now it could be unilateral, it could be bilateral. Even though this orchitis can come from UTI. So now, what would be the sign symptoms? Sign symptoms will be pain, fever, swollen, congestion, color changes, and loss of functions. Orchitis and the epididymitis, both of them will have the same complaint. It is not physical examination, it is not clearly identified, it is who is affected. So now sonographic appearance, what you going to see? Sono appearance. Sono appearance, you will see that testis is enlarged. Enlarged testis. Hypervascular. And fluid, you can say reactive fluid or reactive hydrocele. Reactive hydroceles. Okay, and you will see it is a homogeneous and hypoechoic. Why hypoechoic? Because there is a edema inside because of the infection. Okay? So this is very important. because in the testis, if this is the testis and if this is the peritesticular artery, I am just showing you, then you will understand that how the peritesticular artery traversing that whole testis. So when you click the color, then you see all of them are colorful. All of them are colorful, red and blue, vein, artery and vein, artery and vein, all over. Okay, so this is peritesticular artery and this is intratesticular. Artery. That's why vascularity is very, very important. Always compare the testicles each other, right versus left, left versus right. Okay, so now keep that in mind. In orchitis and epididymitis, if you lift the scrotum, patient feels better. Pain disappear. Means pain, if it is a severe pain, pain will be mild. But in torsion, if you lift up the scrotum, pain will aggravate because the torsion will be more tight. More tight. Okay, and because of the infection, if you let it go down hanging, so gravity is pulling, so in orchitis it will be more painful. More painful. Okay, so this is orchitis. Now I will show you the epididymis. So epididymitis. Epididymitis is the infection of the epididymis. Epididymis has a head, body and tail. It could be focal infection, it could be diffuse infection. Diffuse means all over. All over. When it is focal, head could be inflamed. So normally the epididymis, when we see sonographically, so this is testis, so only the head we can see. This is upper pole and this is lower pole in sagittal view. And this is epididymis. Normally epididymis is not homogeneous, is a little heterogeneous, and when it will be infected, it will be more heterogeneous and enlarged. That time you will see along with the head we see the body and tail. So the whole epididymis is seen. This is head, this is body and this is tail. Do I need to click the color? Yes, we need to click the color. When you click the color, then you will see the whole epididymis is hypervascular. And when there is a epididymal orchitis, then you will see the blood vessels, it is hypervascular, and also the testis is hypervascular too. That time you have to understand the infection spreaded from the epididymis to the testis. Then we call it, and we will see the changes in the testis, then we call it epididymal orchitis. Okay? So the symptoms will be, the cause will be the same. Cause would be the same as orchitis. And the sign symptoms same as of orchitis. And the sono appearance, the way I said to you, it will be gorgeous. It will be gorgeous, heterogeneous, hypervascular, and reactive fluid. We call it reactive hydrocele. So, enlarged hypervascular, then heterogeneous and reactive hydrocele. Okay, so these are the sono appearance. Now I will go over the torsion. So torsion is considered as a testicular problem. Okay. Testicular torsion. Torsion means twisted. Understand that. This is spermatic cord. Look, the spermatic cord is covered by the tissue. The tissue is intact, but inside the materials, they are having torsion. And with this, there is a testis that has epididymis. So this is testis. Now this structure is getting twisted, and this structure is attached with the testis. If these are twisted, then if this testis is bell clappers, the clapper in the bell, it is not tightly attached with the posterior scrotal wall, then what going to happen? This will also have torsion. So now testicular torsion can be without spermatic cord, with spermatic cord. This torsion is without the spermatic cord. All those structures inside are twisted along with the testis. And another torsion, you will see the whole this is testis. This is epididymis. So now look at here. The whole spermatic cord is twisted. And both of them are dangerous because the internal structures, spermatic cord has so many ingredients, vas deferens, and the testicular artery, cremasteric artery, and the other vas deferens artery, and the veins, and the nerves, and the lymphatics, all are twisted. So as a result, the testis will die. Okay? The question that why not every boy or man has a testicular torsion? Because normally this is testis. So this is testis, this is epididymis, and this is scrotal wall. Scrotal wall. So normally this part of the testis posteriorly it is attached with the wall. So that if you want to rotate the testis, you cannot rotate the testis because it is attached with the wall. If somebody born with no attachment with the wall, that means the testis is hanging just like a clapper in the bell. You got it now? It easily get twisted. But if it is attached with my, look at here, it is now attached with my body, right? You want to twist it, it could be half twist, not full twist. So then what is the treatment? Treatment, those who have a bell clappers or they already get twisted once, they open the scrotum and they tight with the wall so that in future it cannot get full twist. So now, who are the victims? Usually the young people, teenager boys. Why they have more? Because they play more, sporting more. They change the posture of the body more, and sometimes they play, they handle, they play with the scrotum. And once it is get twisted, usually it is untwisted automatically. If it does not get untwisted, then it will be swollen, edematous, tightness, and at midnight the pain starts. Then they will call 911 or they will rush to the emergency. Those are the victims. And those who have bell clappers, of course, and causes movement of the testis inside the scrotum. It could be the sporting is the main. And sonographic sign symptoms. It could be asymptomatic initially without any change. Initially no sign symptoms. Then when there is a sign symptoms, it would be pain, swollen, so skin edema, then what else? Sign symptoms. To be pain, it could be little fever and nausea, vomiting because of the irritation of the peritoneum. Okay, so these are the situation. So now sonographic appearance, what you will see. You are doing the ultrasonography. Sonographic appearance, you will see enlarged testis. Initially you will see no change of echogenicity. No change. It looks same. But you are comparing both right versus left. Then you will see gradually no blood flow intratesticularly. No blood flow intratesticularly. That means intratesticular blood flow decreases and absent. Peritesticular blood flow present. Peritesticular blood flow present. What else? Reactive hydrocele. You will see. Now in advanced stage, as advanced case, you will see hypoechoic areas with necrosis and no color at all. That is the danger, that you have to take this tissue out. How you are differentiating it from the orchitis?
Blood flow.
Testicular torsion, how you are differentiating it from the orchitis sonographically?
The blood flow would be...
Exactly. In orchitis, there will be increased intratesticular flow. Here, in torsion, there will be absent of intratesticular flow. Absent. And then echo texture will be changing because it's dying. The tissues are dying. So is there any other modalities? I say we do physical examination, we did blood test, and we did the grayscale and the Doppler color, then is there any other modalities we can prove that it is a torsion?
T2.
Yeah, nuclear, N